Welcome back to Community Conversations. I am Queen Miss Ebony J. You're listening and watching 1230 The Buzz, your talk station, 101.1 The Wiz, and 100.3 Cincy's R&B station. So glad to be here with you. Community Conversations is where we come to talk about things happening right here in our community and how nonprofit organizations are solving the problems. And I have in here with me Miss Sonya Wells, a family nurse practitioner who is here representing African American Ambassador for Excellence in Advanced Practice Nursing. How you doing today, gorgeous?
I'm well. Thank you so much for having me.
Big title over there, big title. Tell everybody, who is the African American Ambassadors for Excellence in Advanced Practice Nursing?
Yeah, so we go by for short AAEAPN. Okay. And we are a 501c3 nonprofit organization that was founded in October of 2019, specifically developed to support and educate and empower the African American nurse practitioner.
So what are some things that you all do?
So we do a ton. We provide educational programs for nurse practitioners that's African American. We provide study tables and round tables for African American nurse practitioner students. We do health fairs, we do screening programs, we do speaking engagements. We do different walks and runs throughout the city, and we do networking events. We kind of do it all, anything that's going to support these nurse practitioners to help them be able to provide the most quality care to their patient population.
How long have you all been around?
We started in 2019. It's 5 founders that started the program just because when we were going through school, we're all nurse practitioners, had a really hard time finding preceptors and jobs, and just really ran into a lot of barriers and roadblocks, and decided that this would be the best possible thing for our community to help them be successful in their careers.
So what is the mission and the vision of AAEAPN?
So our mission is to, like I said, provide leadership, empowerment, mentorship, education for the African American nurse practitioner to provide quality care to their patients. And then our vision was just really to support the professional development for the Black nurse practitioner in maintaining a successful career.
Now, how long have you been a family nurse practitioner?
I have been a family nurse practitioner since 2017, but I have been a nurse since 2001 and worked in all different areas, urgent care, ICU, ER, which now I'm focusing on women's health, really focusing on fibroids right now.
What would you say are some barriers or challenges that you had to overcome in this type of field, especially being an African American woman?
Yeah, I think it's twofold: being African American, one, and then two, being a woman. You run into just a lot of people being uncertain or not really trusting your judgment. And then just not being able to get the right support as far as jobs and internships and things like that. And so with a program and an organization like ours, we're able to pass that information along. We share job leads, we share opportunities that come about. So it's been really a blessing.
Yeah, I know the job field right now is hard. I'm in the healthcare industry with people I know from being home and home aides, but is it really hard right now to find work in the field?
Not necessarily. I mean, it's such a shortage right now in nursing as a whole. And then with the pandemic, it kind of threw a whole nother wrench in the game. And so with that, it's actually a lot of jobs have developed because of that. And so, so that's not necessarily hard. Sometimes it can be more of a struggle finding out about the jobs, or sometimes it can be about who you know. And so that's some of the struggles that brought us to where we are with this organization today. So my job could be hiring, and I would let one of the 64 prescribing nurse practitioners on our roster in our organization know first that there's a position coming available and put a word in. So a lot of it is just about networking and having a strong group of people that you can network with.
That's what I was about to say. I tell people that all the time, it's not what you know, but it's definitely who you know. And like you said, the jobs are out here, but it's the knowledge. So you're just getting fresh out of school. You don't really have anywhere to go, no connections. It's perfect for you to join your organization, because that's what you all do. You helping them with finding jobs, with learning how to be a leader in that area. Because like you said, you're not always perceived as having that trusted point of view, which I think is because we're in a male-dominated field.
Absolutely.
I'm the same way. I'm in a male-dominated field too. They look at me like, you don't know. But it's crazy because, like you said, we're a woman and we're African American. So that's that double-edged sword that makes us have to really push and be persistent and get through. What are some other things that you've noticed when it's coming to giving the young people the guidance with learning about leadership and how to be in that role?
Yeah, I think that's important. We do a lot of speaking engagements at some of the surrounding colleges and high schools. And I think that gets into how representation really matters, because it's about perception, and so they need to be able to see, providers and people in higher levels in different fields that look exactly like them. And so I think that's where it starts, because often they don't even know about nurse practitioners. They don't even know what they do. And so when we come out to different events, we make sure we have our white lab coats on. We're, nice and professional. And so we let them know that you can be in this position just as well.
I love that. You got to lead by example. And like you said, if you don't see people like you doing it, you just have no idea. I tell people that all the time. For me, I always wanted to be a teacher and preacher on the radio, but I never knew nothing about entrepreneurship. Like growing up, no one talked about there's an entrepreneur. Like you knew people had jobs, but who was really sitting around talking about being a business owner, being a boss? But now you look up, everybody's being a boss, opening businesses, doing it. But it's all about that knowledge. It's all about your network. It's all about having that community, which you are providing for our young African American nurses. What do you like? When you're getting people in, what is the intake process? How do you sign up to be a part of the organization?
Yeah, so typically we have you come to one of we host a monthly meeting program that we usually have new members come to. And that way they can meet the organization, talk about some of their expectations and their needs, whether it's looking for employment or preceptorship or internships, things like that, and make those ground root connections with people, and then kind of move from there. And then we have different events that we ask people to participate in. So that's part of it. So it's a couple of different entities, but we just want to show you love, and they show us love. So, we're like, come on.
I love that. Now tell me this, sis, because I'm feeling a little dumb over here. But I want to ask it in case I got some listeners that may have the same question. What is the difference between a nurse and a nurse practitioner?
Yes, that comes up often. So a nurse is pretty much a caregiver for patients that provide and promote care through health and wellness. And they don't work independently. They're usually taking direction from a nurse practitioner or a doctor. And they're associate prepared or a bachelor's degree prepared.
Okay.
The nurse practitioner is an advanced practice registered nurse who is a master's prepared or a doctorate prepared, even a PhD prepared. But we can assess, we can diagnose, treat, we can prescribe, and we usually work independently
Okay,
So
so
we mimic exactly pretty
what
much
the doctor
everything that
do?
a doctor does. Mhm.
Okay, that's what I was about to say.
Mhm.
So when will we encounter you? Boom, we go to the doctor, we check in, boom, and then there's the person that comes to get our, our temperature, our weight. That's the nurse.
That's the nurse. You will be seeing myself or a nurse practitioner as your provider. So you can choose to see Dr. Smith, or you can choose to see nurse practitioner Smith. You see what I'm saying? So nurse practitioners are positioned in hospitals, in urgent cares, in doctors' offices, in OBGYN offices.
Okay.
They're positioned in all different arenas, working as the independent provider.
Correct. So you don't have to see a doctor after you see a nurse practitioner, because
No,
the nurse practitioner has skill level training to know and how to diagnose you and what to look for when they're giving you, your stuff.
absolutely. And even on top of that, in our organization, we have a large amount of the providers that have their own practices. So we can run our own practice just like the doctor can.
Oh, that's amazing. So when we do go to an urgent care, we are seeing a nurse practitioner.
You might see a doctor. So I work in urgent care, and some days it's me, and some days you come and it might be Dr. Joe. So you could see either or.
But with the shortage on, doctors and in the health field right now, is that why we're seeing more nurse practitioners come through and really be able to do it by themselves without the doctors? Or is it still the need for the doctor?
Well, I think that we definitely have the training. We have the years of experience. We have the bedside experience that comes from our nursing background. And I think eventually what happens with doctors is they may start off in like family practice or some of those, but then they want to specialize, so once they go into specialize, then it opens up more need for primary care providers, or providers in the OBGYN offices and so forth. And so that's where we come in and fill that gap.
Okay, look, I'm learning some things today. This is different. Hold on. So one more question. So when you're at the doctor, like, okay, now we're not at the regular doctor. Now we're like at a hospital. You're at the hospital and they have like the three names on the board. So you would be, again, they have a regular nurse who that's only their skill set can provide, just taking our temperature. But the other nurse is the nurse that comes in, which is the nurse practitioner. And then we see a doctor.
No, it'll either be a nurse practitioner or it'll be a doctor.
Boom. So make sure we keep that in mind, that you're going to see either or. You don't have to see both.
You do not have to see both. You can solely see me. So when I work in family practice, I have my own client load and I'm their doctor per se. I'm their provider. So whatever they need, prescriptions, referrals, diagnosis, they're seeing me.
When we're trying to find a doctor, what are some things that we should consider thinking about?
Well, I think that people like to see someone that looks like them and knows different struggles that they've been through. So as an African American patient, it's nice if you can find an African American provider. It's not a ton out there, but there's a good amount. So if you can, that's a phenomenal way to start. And then I think that you need to meet the provider and see, do you guys match personalities? Like, you have to be your own advocate. So if you meet someone and you're like, we didn't really hit it off that good, that's okay. You can check out a different one. And so I think those are the things, and to know exactly what your needs are, know your numbers, know your diagnosis, and kind of go from there.
If you just tuned in, I'm speaking with Miss Sonya Wells, who is a family nurse practitioner, and she is here representing the African American Ambassadors for Excellence in Advanced Practice Nursing. This is Community Conversations on 1230 The Buzz, your talk station, 101.1 The Wiz, and 100.3 Cincy's R&B station. If you've been listening, you're probably a little bit more interested about how you can join. How can you learn more about the African American Ambassadors? Well, understand they have monthly meetings. And during these monthly meetings is where you can actually come and get to know some of the people that are already a part of the organizations. You get to fill it out, and they have events and activities that they do all throughout the year. How can we learn more about AAEAPN?
So our website is www.AAEAPN.org. And we're also on Facebook and Instagram.
Now, I know you said that you do different events around the city. Are there any events coming up that we can expect to see you at?
So we will be doing the Heart Mini Walk on March 19th. So we'll be there to support that and fight heart disease. And then also after that, we will be doing the Closing the Health Gap Health Expo, which is a huge event that goes on every year. And so we'll be there just doing screenings and BMIs and blood pressures and any way we can do, anything we can do to support the community.
Are you all on social media at all?
We are on Facebook, and we're also on Instagram.
So make sure you all get connected, because one of the things I love about this organization, which I think is so important, we go to these schools, we get these degrees, we studying, we making sure we get our stuff right, but then we come out and we have nowhere to go. Well, this is a great network to where you won't be alone. You're able to connect with like-minded women. Oh, are men are able to be a part of this?
Men can be a part of it as well if they're an African American or a brown nurse practitioner.
Okay. Because see, when I think of a nurse, I think of Meet the Fockers, you know, all the jokes. So I'm like, okay, boom, can men still? Yeah, so if you are a man and you want some support, understand this is not just for the ladies. It's just for support for people who are nurse practitioners and they need support. They want to thrive. They have visions and goals. They want to be better. You want some leadership skills. You're trying to learn how to excel in this field. Well, guess what? It's a group of bosses and they want to help you boss up for 2023. All you have to do is pull up to their event meetings. They're going to have monthly meetings. Tell us again, when are the monthly meetings held and where are they held at?
So we hold them at different venues throughout the city. And they're usually the third or fourth week of the month. So the one that's upcoming will be March 21st, and that'll be at Son of a Butcher in Liberty Township. But they can always just go to the website and hit the contact us page, or they can email us at AAEAPN@gmail.com for more information.
Yes, make sure you all head on over right now. Do not miss the opportunity to connect. And do me a favor, if you're listening and you know someone who's an African American nurse practitioner, hang up, pull out your phone right now, give them a call, let them know that this show happened today and that they need to connect with Miss Sonya Wells and the whole entire organization, because that's what we're going to do different in 2023. We're not just going to hear information and just let it go over our head. We're going to help each other connect the dots. So make sure you do your part. AAEAPN is here to support you and make sure that you advance and excel. So if you need it, you ready, you know somebody who could definitely use these resources, please share the information. Thank you so much, Miss Sonya.
And the other thing too is if you are a patient that's looking for a African American provider, you can also go to our website and we will put you together with a list or a provider that's African American as well.
Oh, I love that. So if you're on a search, okay, they're gonna want to make sure that they're pairing you with somebody that's going to match you and that's going to help your health get better too. I love that, Queen. What an organization. Thank you so much for coming on and sharing these gems with us today. And thank you so much for all the services that you're providing to all our other African American nurse practitioners. We need it, and we are so glad that you're opening this door and giving us this support. If you need anything else from us, want to come back on, just let me know, okay?
Thank you. Thank you so much for having me, Ebony.
No problem. Make sure you all head on over to the website and get connected. Again, the event, the first one that they're having, is going to be March the 21st. If you want to be a part, make sure you pull up and just come check it out. You never know what might happen. This is Community Conversations on 1230 The Buzz, your talk station, 101.1 The Wiz and 100.3. I am Queen Miss Ebony J, the host that does the most for you. And if you would love to be a guest on Community Conversations, all you got to do is slide in my DMs or send me an email, msebonyj@radio-1.com. I'll see you all next week. Bye.